everyone, Heather here. So one of the things that I really like about nursing is seeing this person that comes into the hospital all distressed and needing help, and then we as a hospital team of doctors and nurses and CNAs and techs and other hospital staff collectively help these people to become better so we can send them home and they can get on with their lives. One day I was taking care of an elderly lady who came into the hospital with altered mental status and electrolyte imbalances, most likely due from a high level of one of her medications in her system. The first day I took care of this lady, she was all lethargic and confused, didn't know why she was in the hospital, thought the year was 1995, couldn't remember to use her call light, and you know how confused patients kind of like to get out of bed by themselves and set off their bed alarms. So she tried to go to the bathroom, got out of bed by herself, ended up on the floor. Fortunately, did not hurt herself. I, on the other hand, had nightmares about it that night. I dreamt that she fell out of bed like 10 times, and I couldn't seem to stop her from falling out of bed, and I'm like, oh my gosh, how am I gonna keep her from falling out of bed? They're gonna fire me for this. Isn't it the biggest relief to wake up from a dream like that and realize that it's just a dream? Makes me feel like I have the best life being awake rather than being asleep and dreaming those kinds of things. The following day when I took care of her, she was more alert and oriented, and she would use her call light when she needed something. And then the third day I took care of her, she was totally with it, knew what year it was, knew why she was in the hospital, she was up walking around, and even telling me how she takes her meds at home so I would do it the way she does it. And then that day I sent her home to be with her husband. And I remember thinking to myself at that moment, wow, you know, this is really special. This is what I really like about nursing. You know, watching a patient progressively get better, and then you send them home to be with their family. I wish every situation could be like that, but unfortunately, there are some people that don't really care about their health, and so they come into the hospital looking for a temporary fix, and they go back out into their life, and they self-destruct themselves, and then pretty soon they're back in the hospital again. And it's a little disheartening being in the middle of those situations, but that's the way it is sometimes. I worked with this one doctor who had an excellent bedside manner. He would go in and sit with the patient, talk to them, and make jokes. And one time he was discussing with a patient how she got her hernia and her contribution to her health issues. And he told her, you know, it would be a really good idea if you lost weight to prevent further complications. And the patient says, yeah, I need to lose weight. But doctor, do you think I'll always be fat? And he's like, well, yeah. You want to know why? Because it's our American destiny. But that doesn't have to be our American destiny. It's just the easier road to take. In my perfect world, I would eat cakes and cookies and muffins all day long, and then maybe a hard-boiled egg to balance it out. But it's not really balancing it out. And have zero consequences. But that's not reality, and I don't really want diabetes and heart disease. One time when I was on sugar overload, I had this vision of all the sugar roaming around in my veins, and it was creating blockages, and then it wouldn't allow the blood to flow through my veins properly, and I had hypertension, and I was like, I can't let that happen. I gotta change some things. I can't eat like that every day, maybe twice a week. So just remember, you are in control of your health, unless you have hereditary or autoimmune disorders. Try and take care of your present self so your future self can be happy and healthy. Well guys, thanks for watching. Talk to you soon, okay? Bye!